Hello. As our last week approaches, our last assignment on the discussion board portion was to make a video about clinical mental health counseling. Now, I personally believe that clinical mental health counseling is the art of building the relationship with the client to help them walk through the woods of their lives, to address any mental and emotional concerns that they may have, any urges or symptoms of depression and anxiety and suicidal urges, and to identify any moments of success, any turning points, any failures, any roadblocks, and then guide them to self-discovery and to healing and to lead more productive and healthier lives. Now, according to the American Clinical Mental Health Counseling Association, clinical mental health counseling is defined as combining traditional psychotherapy with a practical problem-solving approach that creates a dynamic and efficient path for change and problem resolution. We are the safe space for clients so that they can come and express whatever they need to express, however they need to express it, without any judgment, and we assist them to work out those issues. Also, from the American Clinical Mental Health Counseling Association, licensed clinical mental health counselors are primary healthcare providers. We are uniquely educated and licensed in ways that make us distinct from the other mental health professions, like the members of the other mental health professions, so those of social workers, psychologists, and marriage and family therapists. We either have a master's or a doctoral degree. In our graduate studies, we become qualified in psychopathology and in the diagnosis and treatment of psychological disorders. But philosophically, we are distinctly trained to be holistic and strength-based in working with individuals, couples, families, and groups. In addition, we strive to focus on treating both the symptoms and causes of mental and emotional concern. The second question is, why is clinical mental health counseling an important part of our society? Void of COVID-19 economic turmoil and the continual racial tension that we have in America and in the world, I believe that clinical mental health counseling is important because people need people. I believe that life is hard enough, and that if we have someone that we can talk to that is trained to help us work through those things, life is a whole lot easier. Now, adding in COVID-19, racial tension, economic turmoil, we are all left to ourselves. We are all up under stress in some way, shape, form, or fashion. So I think that as a society, clinical mental health counseling is very important, especially in the time that we're in right now. Clinical mental health counseling provides the necessary tools and insights to manage mental health issues such as anxiety and depression. Ultimately, counseling empowers people to lead healthy and fulfilling lives. The last question is, what is needed to make counseling effective? I personally believe that it is a two-way street. If you have a client who is not really open, they're not willing to talk about themselves, to talk about what they've been through and explore with you why they have gone through what they've gone through, and go down this path of self-discovery with you and take that risk, it's not going to be a very productive relationship. Likewise, if you have a counselor who is not their best self at the moment, who is maybe distracted or maybe is imposing their own opinions and values of the situation upon the client, you're also not going to have a very productive therapeutic relationship. According to the ACA Code of Ethics, trust is a cornerstone of the counseling relationship, and counselors have the responsibility to respect and safeguard the client's right to privacy and confidentiality. Counselors actively attempt to understand the diverse cultural backgrounds of the clients they serve, and counselors also explore their own cultural identities and how these affect their values and beliefs about the counseling process. Having a high regard for the 6 moral principles listed in the Code of Ethics, which are respect for autonomy, non-malevolence, beneficence, justice, fidelity, veracity, I think are also very important things that a counselor must have to be effective in counseling. Well, that's all that I have for you guys. We're almost to the end of this course. We all hung in there. I'll see you guys on the other side.